that you moderated. Thank you to the speakers. That was to give us a very good overview of health challenges and opportunities. This next session that we're going right into is about resources in cities, and there are a number of excellent presentations. This is going to be moderated by David Dudley, who is the editor of CityLab. So I'm going to ask you to come on up and make the introductions. Hey, thank you.
Good morning. How are y'all doing here? Thanks very much to the organizers and Dean Galea for having me here. This is a really interesting collection of characters. Let me open briefly by talking to you a little bit about what CityLab is. Hopefully some of you are familiar with it. CityLab is a digital publication. We're published by The Atlantic, the folks who make The Atlantic magazine, and Atlantic.com. It is available free over the internet at CityLab.com. And we are a publication that is focused on really the challenges and the solutions and the whole kind of spectrum of challenges that urban places around the world are going to be facing. So we like to say we write about and show stories about how cities are going to survive and thrive. Lately, that's been a very interesting beat to have. This is, as you know, a very kind of a fascinating time to be covering the state of the urbanizing world. And you've all heard the statistics about the percentage of people who are going to be living in metropolitan areas in the future, and how this is really an unprecedented kind of confluence of factors that are making cities such powerful kind of globe-shaping hubs of innovation and job creation and economic activity and all that good stuff. It's a great, from a journalistic perspective, I've covered a lot of stuff in my career, but cities are fascinating because they're places where people have to engage with problems, whether politically or otherwise. You really can't just sort of pontificate and let things marinate. You have to actually address the issues. And in an era where we're facing just so many serious problems, I really do think cities are going to be the places where we're going to see solutions, whether it's climate-related, energy-related, public health-related. Look to those urban areas as the places where the ideas for the future are going to come from. They are, as I said, hubs of activity and innovation. They're also incredible hubs of inequality, which is the other sort of kind of great overriding theme of our era, in which we're going to kind of undergird so much of what you're going to hear about today. There's a lot that can be said about the differences between just here in North America. We write a lot about the booming cities, the Seattles and the San Franciscos and the New Yorks. We also write a lot about the sort of the struggling places. And what's striking is that really they share a lot of commonalities. They share a certain kind of set of tools. They have a physical infrastructure, they have roads, they have pipes, they have utilities. They have the social infrastructure, as Eric Kleineberg calls it. They have the sort of the social networks that are built around libraries and schools and coffee shops and sort of the interrelationships between neighborhoods. And the folks that you're going to hear from next are going to talk to you about sort of how these pieces can come together and the tools that cities can use to make huge differences. We're talking about housing and transportation and economic conditions and food and very kind of basic things that Buffalo and Detroit share in common with Paris and London. The way that those elements interact with each other and they can feed off each other is really, can be a very powerful thing. You take a struggling area, a neighborhood that isn't working, and you change the park, or you put a bike lane through it, or you reorganize a street so that there's parking only on one side of it. People get upset. It's a fascinating dynamic to see play out in cities after cities. But you can make very modest changes and really change the lives of thousands of people in a very dramatic way. So let's bring them on. We have a very tight schedule. I like to think this is sort of like a supercut of the greatest hits of what you're going to be hearing today, because we have literally the whole kind of span of urban resources you're going to get a glimpse of. So without further ado, let's bring on our first participant to talk about housing issues. Is Roshanak available? There she is. And we'll do this the same way we did the previous show. We'll bring on the succeeding panelists as they go, and then at the end of the show, we'll bring everybody up for some question and answer. I know we're on a tight schedule, so let's go.
So hello, my name is Roshanak, and thank you for having me here today. And I'm going to talk a little bit about housing and health. I cannot go into it in details in 7 minutes, so it's more of an overview, but I'm happy to discuss some of the projects we're doing later on. There we go. So housing is a determinant of health, and in fact, it's a multidimensional determinant of health. Some of these dimensions that we study include affordability, so mortgage, rent, utility costs, property taxes. We talk about access and not just attaining a home, but also maintaining the home. And finally, we talk about conditions both inside and around the home. Up to now, most of the research in public health has focused on each of these dimensions independently, but also mostly at the individual and neighborhood level. However, a socio-ecological model approach, like the one we've presented here, is much needed, as these dimensions are heavily influenced by the macro levels, including the political and economic systems, and also the meso levels, which include housing policies and real estate markets. Furthermore, this model holds true in most cities around the world. And why I say there's a need to focus more on the higher up levels is because we have strong evidence that attributes the roots of housing inequalities occurring at a point where housing became a commodity, symbolizing social and economic success as opposed to a basic human right. So looking at each of the dimensions, in different cities around the world, housing affordability is defined as no more than a certain percentage of household income used for housing costs. In the US, it is 30%. However, in 2018, approximately 12 million households paid more than 50% of their income for housing. In fact, as this map shows from CityLab, that the wage of one person within a household the wage that one person in a household has to earn in order to afford a 2-bedroom housing. In 2018, no city in the US was considered affordable with a single minimum wage earner. Such households are considered cost burdens with huge implications and limitations on what they can spend on other life essentials like food, transportation, and medical care. 2018 marked 50 years since the passage of the Fair Housing Act in this country that prohibits discrimination based on various characteristics like race, age, familial status, gender, and others, at the time when somebody tries to purchase a home, rent, lease, or finance. This year, we have also seen an increase in the number of housing discrimination cases reported across the US. Covenants like the one you see here still exist in this country and other cities around the world, resulting in not only modern-day gentrification and segregation, but also contributing to the persisting redlining traditions of the early 1930s. And here's a map of Detroit where the red areas shown were considered to be too financially risky, or in other words, not white enough to issue home insurance, and in turn to access to programs and resources that allowed individuals, mostly white, to purchase their homes, ultimately restricting access to affordable homes and contributing to the long-term disinvestment in urban communities. So the results of these actions have translated into this unequal distribution of resources in neighborhoods across the city, limiting education and employment, but also the inability for mostly people of color to own homes and accumulate wealth, a very strong indicator of health inequalities. Finally, housing conditions has been mostly studied in association with public health. It's the one that we've overstudied or still study a lot. And we know that now within a whole house, mold, pests, and asbestos is all hazard. However, more attention is also needed on the indirect effects of housing conditions, including social isolation, when a 5-year-old says that their house is too ugly, and the effects of their noise pollution on sleep and rest, resulting in the inability to succeed in work and school. So, what does this all mean for cities? Until we start referring to housing as a basic necessity and not a commodity, we are heading to really troubling times. More and more families and individuals are becoming evicted from their homes, or bypassing food on their tables and medication so that they can pay for water or electricity. To give you an example, we work with families in Detroit, and I'm talking about having only $50 a month left to purchase food and medication for their families of 4. Cities are losing firefighters and teachers because their wages can no longer afford a home in the city. And finally, the concept of aging in place is becoming more attainable with increasing housing costs and pensions not being able to match those housing costs. Therefore, more attention is needed on housing because it is the foundations for thriving neighborhoods and, in turn, healthy cities. And I'd like to thank my co-authors on this. Others. Thank you.
Thank you so much. Great pleasure to be here. Could I have my slides, please? Many thanks for inviting me to speak. It's my day off today. We're having a holiday in Spain, but it's Mark Nieuwenhuijsen. It's coming up on the slides. Many thanks. I'll be talking about, if I can find it, about transport and health. And I jump straight in the big issue there. The big challenge that in many cities we're facing is the car. We're having too many cars in our cities often. We're so reliant on our cars, causing an awful lot of problems, of course, that not only for health, but other issues as well. Even when we're not using the car, remember that 96% of the time we're not using the car. It's just parked there, but it's taking up space that actually can be used in a much better way. Imagine, if you see all these cars parked, that this would not be cars, but this would be trees. This would be green, a much nicer environment in a way. So this is a simplified framework that I work under in relation to transport and health. And this brings together that, how you design the city determines how people get around, what kind of pathways there are towards morbidity and premature mortality. So in a way, if you invest and design a city for cars, you're going to get a lot of cars. That means that you're also going to get air pollution, you're going to get noise. The car infrastructure can cause heat island effects, because of the asphalt and all the parking or whatever you need. You're also going to get more stress, you're going to get less social contacts, you're going to have less physical activity, more obesity, higher blood pressure, leading in this case to cardiovascular disease, but there are also other diseases actually you can look at, and leading to premature mortality. On the other side, if you invest and design a city, say, for active transportation, say, for cycling, what you're going to get is that more people are going to cycle. There's going to be less air pollution, less noise. You need less space, or less probabilities for heat island effects, less stress, more social contacts, more physical activity, less obesity, less blood pressure, and less cardiovascular disease. I think we know this quite well. If you want to look, there's a review that I've written on this where you can find the scientific evidence. Recently, we did a health impact assessment in Barcelona, where I'm from. And here we asked ourselves, what if we would meet the guidelines, international guidelines for 5 different indicators for this particular area around transport, in relation to physical activity, air pollution, noise, heat, and green space. I mean, green space is that, you could use the infrastructure that you use for cars now for green. What would be, how many deaths could we prevent in Barcelona? And so for physical activity, you're supposed to do half an hour of physical activity every day, of moderate to vigorous physical activity. A lot of people in Barcelona don't get it. Also air pollution levels are 60 microgram per meter cube for PM2.5. WHO says 10 microgram. So we looked at this and we found that we could prevent almost 3,000 premature deaths each year in Barcelona if we would meet these guidelines. And this is about 20% of all mortality. There are about 15,000 people die each year in Barcelona. And you can see that the most benefits would come if we get people a bit more physically active. This is followed by air pollution, well known. Many cities deal with this problem. And also noise. People forget that noise actually kills you. It causes a lot of disease. But then also the heat island effect. Barcelona city center is 4 or 5 degrees hotter than surrounding areas. And we have a lack of green space. Normally when you look at transport, when you look at the cost of transport in case of mortality, you look at traffic deaths, and in Barcelona we've got 30. So actually the impacts we see are about 100 times bigger than what you would normally think of the impacts. Recently, the electric car has been pushed as the solution for this, and I don't think it's actually the solution to what we have, because the electric car is still a car. It still takes up space. I mean, you reduce air pollution a bit. You don't have the tailpipe air pollution as much, but you have still air pollution from tires, brake wear. You still have the noise from the tires, less from the engine. But it's still a car. People don't do physical activity while they're sitting in the car. I mean, and also it takes up space, is what I said, that we could actually use for a much better way. I mean, in a city like Barcelona, 60% of public space is taken up by cars. Well, they only do have a small part of the transport mode. So, this public space you can use in a much better way. Then the other technology that's coming is the autonomous vehicles, as giving us the kind of solution. Actually, I don't know what's going to happen with this, because we don't know how people are going to react to this, how they're going to use it. I mean, are they going to use it more? They're going to kind of use more because they come out of public transport, going to use this because it's going to be cheaper, or they're going to live further away from home, generating more vehicle kilometers driven. We don't have an idea. I mean, in principle, it could be a good thing for public health if it's going to be shared vehicles, autonomous vehicles, so less vehicles on the road that are not parked or going around, and if we keep the same trip journeys as now. I mean, it would be good in that way, but we don't know if that's going to happen, what the future actually is going to be. For me, I'm going back to more kind of, all the technology actually that can work quite well. I mean, and that's actually that we should get people out of the car, getting them to cycle, getting more active transportation. Remember that 50% of car journeys are less than 5 kilometers. I mean, easily replaceable by, cycling. I mean, not necessarily walking, but cycling. I mean, it's easy to do in this way. Cycling has many different benefits. It reduces premature mortality, reduces air pollution, noise. You use the time, the transport as a gym. A lot of people don't have time to go to the gym, so if you put this in, if you cycle to work or to school, you have your gym built in. Also zero emissions for CO2. Takes up much less public space, and also it creates more happiness. Some people say, oh, no, it's hilly or it's too far away. Actually, now we've got lovely new technology. The bike, electric bike, great actually for this, that. However, you need to have safe infrastructure. And this is a study with 168 cities in Europe. We look at the relationship between the infrastructure for cycling, kilometers per 100,000 people, and the cycling mode share. And you see that up to 25% mode share, there's almost a direct relationship between how much cycling infrastructure there is available and the percentage of people cycling. Above 25%, it breaks down. But you don't know what comes first, the cyclist and then the cycling, or vice versa. But at least it's a very good indicator and seems to be extremely important. Of course, this has all to do with land use. You know, we have too many sprawl cities, long distances you have to travel. Well, we actually need to have much more denser cities, more compact cities where you get things, people closer together, more mixed land use. So it encourages people more to walk and cycle and leave the car at home. Still, this is Barcelona. We still have problems with the cars, so we're trying to get new designs like the superblock to get cars actually out of the city. And it's a really interesting new development that we modeled and where we see many health benefits. And perhaps we need more extreme solutions. Hamburg say that go car-free by 2034. I really hope that they can do. And there are other European cities following this as well. If you want to try it out, this kind of car-free idea, go to Vauban. It's an area of Freiburg that's at the moment car-free. It's a really nice area, no cars allowed, sustainable housing, wonderful place actually to walk around and hear the little birds, I mean, without being bothered by cars, and with good connections on the tram to the city center of Freiburg. We need to have many stakeholders involved to be able to do this. I come from a public health background. I'm working with urban and transport planners actually trying to make our cities healthier. But there are other sectors that need to be involved, and we've heard some of it already about governance and getting people together. One last thing, we tried to do this. We just published a book where we brought together urban planners, transport planners, environment people, health people, trying from their angle to describe how they think how we can make cities actually healthier. And it's been a very nice exercise doing this, and so we come from very different backgrounds, but it's been fruitful, and hopefully we can continue this. I would like to leave you with this picture. Many of you that know that we seem to be designing more cities for cars. Actually, what we're looking for is designing cities for people. And, you know, I'm hoping that this is kind of the future, where we don't have to sit in the car to go to work, but where we can cycle or skate or walk, you know, in nice green space. I didn't address green space, but green space is very good for you as well. And that we can actually enjoy our journey to work or to school or wherever we want to go, and that it's healthy as well. Thank you so much.
Good morning, I'm Suglia from Emory University, and I'm going to talk about how we think of these resources when we're thinking about children and adolescent health. And I'll give you, I'm thinking of 3 themes that we think we need to consider when we're talking about children and adolescents. And I'll give you the punchline at the beginning. I think we think about developmental stages of children, not only physical health, but social, cognitive, and emotional health and development when we're thinking about children in cities, as well as the social factors that are interacting with the built environment and with these resources. So, as you know, the prevalence of the populations living in urban environments is increasing over the last several decades, and this is also true for children and adolescents, where we have a large proportion of the urban population that is of the 0 to 18 years of age. And the rise of the obesity epidemic gave a lot of focus to the neighborhood environment, particularly in urban spaces, thinking about parks, recreational facilities, and how that impacts this energy balance of physical activity and diet when we're thinking about access to healthy foods. And the focus has largely been on the physical impact on child health, particularly with obesity. Rightfully so. If we look at this graph at the state level, we can see an inverse relationship between the quality of the built environment and obesity prevalence, in that as the quality of the built environment decreases, the prevalence of obesity increases. But what I like to propose is that the built environment can impact not just the physical health of children and adolescents, but also other aspects of child development. So these same parks and recreational facilities can affect how children children play. They can affect, obviously, sedentary behaviors and increase physical activity, but there are also opportunities for social interaction and for cognitive stimulation. And so they can impact a number of factors on child health development that go beyond just physical health. The second theme that I think we need to expand on is considering the social environment and how those features impact mental health, how they impact social development, and how they impact, obviously, physical development, as well as how they interact with the built environment. The example that I like to think of when I think about this interaction is we can have a beautiful park in a neighborhood, but if the neighborhood is not safe, if the community doesn't feel like they can contribute and go to this space because they feel welcome and trusted, they're not going to use the physical space. And then lastly, I think we should consider developmental stages. So as children grow, their environment changes. 0 to 18 age period is a really wide period, and it encompasses a lot of multiple developmental stages. In fact, infants are interacting with their environment primarily through their parents and their caretakers, and their environment is mostly limited to home and childcare. And as children grow older, they start to interact more broadly with other features of the environment. School-age children now add the school and other recreational sources to their environment, and adolescents start to gain autonomy, and they're interacting with the environment and with activity spaces beyond, independently. It's not just focused on, parents and caretakers. And all these factors, all these different stages have different impacts on child health development. It's also evident that the different developmental stages of the child not only impact the child and how they interact with the environment, but they also impact the parent. And this is beautifully illustrated in these maps where the panel to my right is showing the activity space of a mother, same income level of a mother with an older child. And in the right side of the screen, you have the activity space of a mother with an infant, a much smaller activity space within which they're interacting with the environment. How do we design cities for children and adolescents? So we kind of think of these two very simple questions in a way. One of them has been proposed as this popsicle test. Can a child actually leave their home, buy a popsicle, and come back before the popsicle melts? Can a child actually go trick-or-treating around their neighborhood at Halloween? And these sort of two questions bring both features of the social and physical environment. So that we need to think of, these two questions get at, walkability, pedestrian safety, safety from crime, a trust and a cohesiveness, as well as the accessibility of resources that the children can access when they're living within their neighborhood environments. So definitely things that we should consider when we're planning or designing cities for children and adolescents. Much of the work to date has, again, as I noted, focused on parks and recreational facilities, but I think I reiterate that we should really focus on how social factors impact these built environment features and how they impact features of other health outcomes, not just physical health, but cognitive and social development, as well as different developmental ages. This is an ad from the High Museum of Atlanta, which has a teen night the first, believe Friday of every month. Just demonstrating that the neighborhood environment, it's not just the physical resources of parks or recreational facilities, but for teens and adolescents, those recreational facilities become much more than just a park or a green space. And so I'll end by noting that given that child health and well-being obviously is relevant for health in childhood and adolescence, it is also setting the stage for health across the life course. And so it's important to focus on how these resources are impacting children and adolescents, because it will have an impact long-term across the life course. I'll stop there. Thank you.
Hi, thanks for having me. My name is Atheendar Venkataramani. I'm an assistant professor at the University of Pennsylvania. I'm a health economist, and I got to write this chapter. Thank you both for the opportunity with Alex Tsai, who's a psychiatrist and health services researcher here in Boston at Massachusetts General Hospital. I'm going to talk about economic conditions and urban health. It's a big topic, so this is going to be skimming the surface. We'll do one deep dive, though. All right, so we've seen a lot of conceptual models, and I think this is how economists would think about a city. So why do cities exist? Well, it's a great way to bring together capital, labor in a single place so that you can have efficient production. Cities are a great place for people to come together to generate ideas, ideas which can spur further technological advance and further economic growth. So in a best case scenario in a city, you have economies of scale from knowledge and from production that spill over to other domains, and you can get further economic growth. So that's what we're seeing in Boston with the tech sector. On the flip side, other cities can be left behind if there's a shock to the kind of production that they have. There's a loss of key knowledge, capital, or labor, and they can languish for many, many years. The growth of cities is limited also by certain economic factors. One in particular is congestion. So historically, population growth in cities was limited by disease because people were close together, infectious diseases were rampant, and of course that was an unsavory situation for many. With public health advances, that particular constraint has loosened over time, although you do see that still in some low and middle income countries, but others, such as pollution, can also be important in the future. We talked a little bit about crime. In the same way that cities bring together people to be creative, to generate positive things, you can also bring people together to be creative about negative things. So organized crime is one such manifestation of an economic process where there's returns to scale, potentially. So you take these forces together, right, and then you have political and economic institutions that define who gets what within cities, and that will drive both inequality across cities and within them. So here's some examples. These are all from the United States. So in the graphs I'm about to show you, that gray line is going to be the cities that are doing the best in terms of per capita income as of the year 2000. Okay, so starting in 2000, these guys were ahead. And then at the bottom, you have cities like Detroit that were behind to start with. So the first thing to note is, in terms of per capita GDP, cities that started out doing better have just continued to do much, much better, while cities that had started off doing worse have languished behind. And this is over the last 15 years or so, but you could take this graph and go back 50 years and get something very similar. So this is per capita GDP within cities. If you look at life expectancy, this is the same group of cities, right? The cities that had the highest GDP to start with versus the ones that had the lowest. You start to see that life expectancy here at the age of 40 has also diverged in the same way that economic status has diverged. If you look within cities at the gap in life expectancy between the richest and the poorest citizens, cities that were doing well to start with tend to have smaller gaps within the city as far as life expectancy, whereas cities that had lower per capita income to start with have wider gaps, suggesting that a lot of what's driving poor health outcomes in cities is what's happening to the poorest citizens, especially dynamically over time. So we've seen some conceptual models that integrate a lot of different factors, suggesting that economic conditions, as well as some of the other factors that we talked about, work together multiplicatively to generate health outcomes. So what I'm about to tell you is very simple when you take it in the context of that model. But if you look at, in 2014, the variance in life expectancy in the poorest parts of the population in each of these cities, you can explain about 50% of that. Again, you can't do a variance decomposition when you have multiplicative interactions, but simply just 50% can be explained by a few factors. That is college graduation rates, rates of social mobility, and the way inequality is distributed spatially, so income segregation. So that's pretty impressive considering we didn't really have to work hard to get 50% of variance. Of course, there's 50% left over, but nevertheless, this is a really strong argument that we should be thinking hard about economic conditions. So what drives the kind of evolution of economic conditions and its relationship to health that we've seen in cities? We know from Sandro's work with Jacob Bohr that the relationship between income and health has only gotten stronger and stronger over time. One piece is that technology changes, and economic policy, especially relating to trade, leads to changes in the employment opportunities that are available for lots of people. And so skilled labor in particular has done very well because the returns for skills have grown and grown in this economy. But people who have, say, high school education or less have been falling further and further behind. There's also a host of economic policies. You can think about financialization of the economy, the way taxes are set up, the reemergence of certain monopolies, the decline of labor unions. All of this can potentially concentrate wealth and political power among a few, generating social unrest potentially. And so this is something that Joseph Stiglitz and Angus Deaton are particularly worried about, that the elites can capture the political institutions and have policies that effectively preserve that hierarchy. And in low-income settings, there's additional challenges. So with rapid population growth, especially of informal labor, and the lack of space, you have proliferation of slums, and unsustainable demands on infrastructure such as water, which maybe had been put together 50 to 100 years ago. So we're starting to see some of those cracks opening as cities grow very quickly in those areas. Alex and I thought that, reading the literature, there's a lot that we don't know still. So here are some factors that we listed that potentially could be driving health within cities, but how important are they relative to others? And the other question is, what can we do about it? So what are moderating factors of these relationships, right? How do we decouple the relationship between income and health? I'm going to give you one quick example. So if you've been reading the news in the United States, you saw that GM is laying about 14,000 workers off. This was, I think, a week or two ago due to restructuring. You also saw this piece of news, which is that US life expectancy for the third year in a row has declined, predominantly driven by substance use and suicide. So in one of our projects, we're actually trying to look at this exact relationship. Does that top piece of news explain the bottom piece of news? And so here's a graph where we've econometrically looked at the effect of a plant closure of an auto plant, this from the 2000s onwards, on deaths of despair, namely suicide and substance use disorder deaths. And what you can see is, starting at the vertical line, the time when this plant closes, by year 4 or 5, the rise in the death rate from these particular causes has gone up by 40%. So that's pretty striking. And we're not quite sure, can you stop this? Like, maybe. So one of the things that we did note is that places that have better social capital to start with tend to have a much more muted relationship, suggesting that there is policy that can break this link, but we don't quite know where that is. So I would submit that there's a lot that we need to do, both empirically and policy-wise, to understand this problem and try to figure out what we can do to reduce the negative influence of economic conditions on health while preserving some of the positive influences that are there. One thing we can do is wait. So we know from history that within city inequality, when people are together and you can see the haves and have-nots so clearly, generates corrective political responses. So we saw a little bit of that with the Occupy movement, for example, and then this new wave of progressivism that we're seeing now. That's potentially not a great, doesn't feel good to say just wait it out and see what happens. So maybe we can be a little more prescriptive. So one thing is thinking about, well, what was happening when things were doing really well. So when inequality in health and within cities was lower, we had large-scale investments in education. This was in the middle of the 20th century, expansion of social services, and really a good organization of the middle class, both economically and politically. So what is that going to look like in the next generation? Is it going to be something like the basic income grant? Is it going to be new financial products that protect against the risk of automation-related job loss? Is it going to be interventions like the U.S. government does anytime a base leaves a particular area to kind of fill it in with a new economy? So I think this is unknown, and I think this is where the future of urban health research, at least as it relates to economic conditions, should go in our view. Well, thanks so much. Appreciate it.
Good morning, everyone. I'm Monica Wang. I'm an assistant professor at Boston University School of Public Health. And today I will be presenting on improving healthy food access in cities. And I'd first like to extend thanks for being able to write this book chapter, as well as to acknowledge my wonderful MPH student who was a co-author with me on this piece of work. The green button, okay, perfect. So we know that building healthy food environments in urban settings is a priority nationally as well as globally, and there's substantial evidence that our built food environment profoundly shapes health. We know that in many cities with high fast food densities, combined with low access to fresh food produce through grocery stores, has led to a proliferation of poor urban foodscapes. And living in unhealthy food environments has been shown across multiple studies to be associated with poor diet, as well as elevated risk for obesity and a plethora of diet-related chronic diseases. This also leads to premature mortality rates, and we've seen these associations persist even after adjusting for individual level risk factors. We also know that disparities in our food environments translates into health disparities. The quality of our food environments is systematically different depending on the socioeconomic composition and the racial ethnic composition of communities in the United States. Neighborhoods with higher proportions of low-income or ethnic minority residents are characterized by not only fewer supermarkets, but also smaller grocery stores and higher densities of fast food outlets and convenience stores. This is largely in part due to institutionalized discriminatory policies such as redlining and restrictive covenants that systematically promoted economic opportunity for white families over racial ethnic minority families. And this ultimately exacerbates health disparities based on socioeconomic status and racial ethnic composition. Now, there are several opportunities that we can take advantage of in terms of utilizing existing resources to improve healthy food access in cities. And if you haven't heard this message enough already, I'll reiterate it again because it's that important. The first opportunity is that we can really focus on bridging efforts and leveraging resources across multiple sectors in order to improve our built food environment. Several cities in the United States have pursued healthy food financing initiatives to develop healthy food retail, including farmers markets, mobile markets, and the opening or renovation of supermarkets, particularly in underserved communities or food deserts. These initiatives bring together leaders and representatives from across sectors and disciplines. For example, Mandela Marketplace is a nonprofit that initiated a cross-sector partnership to open up a cooperative grocery store in a historically disinvested community in Oakland, California. Partners included local government, small businesses, local family farmers, community members, as well as academia, and their collective efforts led to the opening of a community-owned cooperative grocery store in 2009. The second opportunity is that when we increase healthy food access in cities, we can provide opportunities for urban revitalization and economic growth. And these efforts need to be systematically evaluated. Opening up full-service supermarkets can provide opportunities for urban revitalization. According to the Food Trust, for approximately every 10,000 square feet of grocery space, this generates about 24 jobs. In Philadelphia, their fresh food financing initiative led to the creation of 88 supermarkets and 5,000 jobs over a 6-year period. Establishing these healthy food retailers can increase community tax revenue and overall economic activity. And it's also associated with increasing the livability of a neighborhood. It provides a place for community members to gather and host and have social events in a positive space. So there's tremendous opportunity for benefits beyond community and population health when we invest in the food environment. And we need to document some of these non-health outcomes because they're priorities for policymakers, business owners, and the people who actually live in that place. The third opportunity is that increasing access to healthy food creates opportunities to collaborate with industry. And you might think that there might be some conflicts of interest because the food and beverage industry are powerful economic operators in shaping the commercial determinants of health. But I strongly believe that industry and the commercial determinants need not be health undermining by default. And pursuing proactive partnerships with industry can facilitate a more systematic integration of the science in shaping population health for the better. For example, a partnership between the Healthy Weight Commitment Foundation and 16 food and beverage companies, including General Mills and PepsiCo, led to an industry pledge to reduce calories in the marketplace by replacing calorie products with new lower calorie products or reformulating existing products. So there are plenty of opportunities to find and use these windows to improve cities' access to healthy foods. And this will ultimately help us understand how various policy and environmental interventions can help reverse obesity and chronic disease epidemics. Now, opportunities to build these healthy food environments in urban settings must be considered within the context of key challenges, and I'll highlight 4. The first is that if we improve the built urban environment and ultimately target urban health, this requires targeting both access as well as demand. Simply opening up a supermarket in a food desert is not often enough to drive utilization or change in dietary preferences. And so to be successful in promoting healthy eating and overall urban health, reshaping the local food environment must be accompanied by a community demand for such changes. The second challenge is that creating healthy urban food environments requires substantial time, resources, and investment from across multiple sectors, including policy. Nearly every expense for supermarkets are higher in urban cities than in suburban places. And this is because costs such as training, inventory loss, maintenance are substantially higher in cities than they are in suburban places. Efforts to revitalize the built food environment also requires substantial investment from policymakers, and cultivating that relationship can take time. The third challenge is that very real consequence of improving our urban living environments is that it might lead to the displacement of low-income racial ethnic minority populations and ultimately exacerbate health disparities. When we introduce new healthy food retailers into a neighborhood, this can result in relatively large increases in rent and home values in low to moderate income neighborhoods. This so-called Whole Foods effect has been experienced by several US cities. When a Whole Foods opened up in Logan Circle neighborhood in Washington, D.C. in 2000, commercial investments accelerated and the cost of living quadrupled, which led to the displacement of about 20% of their Black resident population over a 6-year period. We need to seek out strategies that prevent displacement as a result of gentrification. And some strategies include rent control as well as expansion and preserving affordable housing in order to promote equitable and inclusionary urban health food environments. And lastly, it can be really difficult to evaluate environmental interventions that target healthy food access because it can be difficult to disentangle social and environmental contexts. Every city is in part characterized by the people who live there, and cities are not just defined by what our environments look like, but by the living and breathing culture of the people who live there. And that is a dynamic type of force that we need to consider. Ultimately, improving cities' access to healthy foods requires that healthy urban living environments, that people who make decisions around creating these environments, including policymakers, stakeholders, scientists especially, that we all adopt a health equity lens in pursuing this approach. So thank you all very much.
Thank you so much. And if I could invite our panelists back to the stage. I think we've got about 10 minutes for questions. So let's maneuver over to these comfortable looking chairs. Is this on? One question. Two questions. All right.
For the person from Barcelona, I'd like to invite him to the Minuteman bike path for 8 months and to tell me it's stress-free. Come on back and you can bicycle with me, because even though it's highly used trail, I don't know what's going on in Barcelona, but as a bicyclist who use rails to trails all over the country, especially in Quebec, there are a lot of positives, but it's when you commute into Boston, there's a lot of stress involved with that. That's number one. And my second point, quickly, for the person, I'm a little concerned why you put up Whole Foods at the beginning, an expensive multinational owned by a multinational corporation, Amazon, and a lot of people, middle class, lower middle class, cannot afford Whole Foods. And regarding your comment about co-ops, we just lost 2 food co-ops in the Boston and Cambridge area after 45 years. It's very difficult now with the competition with large food markets, grocery stores, to compete in inner cities. Thank you.
Thank you so much. I don't know your cycling path where you go, but yeah, no, some of them can be stressful. And recently, actually, was a really nice study in England where they qualified the cycling paths by being stressful, not stressful, and this kind of thing. So, I mean, it depends where you put them and what is around them. That my experience in Barcelona, they just introduced 100 kilometers of cycling lanes, and it's actually much nicer to get around the city. I mean, still, it can be a bit stressful because you just have the cars going past you, making a lot of noise, but hopefully, you know, slowly but steadily, they push out the cars more and more and increase the cycling lane, so we don't have to deal with too many cars around us. There are many improvements still to be made, but I think, you know, cycling, I don't only think, but I've seen in my studies that cycling is a much less stressful way to get around than getting in the car. It's much better for your mental health. It's much better for many other health indicators, and that's why I specifically promote cycling. And of course, I must say, I'm from the Netherlands. I grew up, I cycled before I walked, I think, like we do in the Netherlands. My vision or my hope is still that the rest of the world is going to be like the Netherlands. For you that have been there, that I think we have a long way to go. But remember, also in the Netherlands, they started in the 70s. It took a long time. It took a long time to get there. But, you know, they did it, and they're doing quite well. Thanks.
I certainly agree with your comment regarding Whole Foods being very expensive for the majority of residents. And I also agree that it can be really difficult for small co-ops to be successful and function when they are competing with large industry forces. And that's another key challenge that we need to figure out in terms of making sure that we're not only making healthy food access available, but also affordable.
I'm David Siskovic from New York. And I have a sort of a general question for everyone. And that is, some of us have thought that cities and states, and to some extent the feds, have prioritized economic development over health and the environment. And I'm just wondering if you have any thoughts about that. And I'd like to add, much of our discussion today is about cities, but thinking about everything being local, I think some thought about neighborhoods, which was mentioned by some of you, and families would be particularly important to add to this discussion. Since, let's say, in New York City, 80% of people live in segregated neighborhoods.
If I can start, yes, I think I see a trend that more cities starting to think about including health and inequalities into their planning and to their general strategies. I mean, if I look at the case of Barcelona, if you look at the planning, what I did 10 years ago, there was no health mentioned. Now they want to have health in there. And I'm working very closely in my team with the Barcelona Council, with the metropolitan area, actually to try to get health and equalities in their program. And I think most of my experience from Europe, and you see that actually quite a lot happening. I think what happened so far, what they tried to focus on economic prosperity didn't always work. I mean, they need to have new impetus, and you know, health is there, livability is in there, and they're competing with these particular aspects against other cities. In that way, I'm quite optimistic. If it's going to happen, if we really make them healthier, I'm not sure yet. I mean, I'm trying to provide the tools, the data to help policy making, and hopefully it's being picked up.
Yeah, I'm optimistic. I agree with you on both counts. As far as incentivizing and addressing health disparities, I think that's starting to happen. One of the nice things, I come from this from the health system side, but one of the nice things that's happening is there's been a lot more discussion about how to integrate health and social services together to make them more impactful. So I think we're seeing this in Parkland, for example, and I think there's great case studies in a number of US cities where I think it's hard to always scale from an individual experience, but I think there's a lot of discussion. And as far as neighborhoods, one big constraint in understanding neighborhoods and sort of their effects on both short and long-term health and economic outcomes is the data. And I think Raj Chetty now over at Harvard has done a real service in kind of at least addressing this issue descriptively with big data approaches to identify what are the impacts of individual neighborhoods within cities. So that's like a new exciting area. The data is becoming more and more available. So I think we have a lot we can learn and do.
I'll just add a note in terms of family. So I focused on children and adolescents and how they interact with the neighborhood and the environment. But clearly, the first network, if you will, of children and adolescents is the family, and so we need to better understand how that dynamics play out and how the families as a unit interact with neighborhoods and environments. That parents are obviously influencing child health, but we also need to understand that children's health and development is going to influence the parents' health, and I think that would go a long way for understanding how sort of families move within environments.
We have a question in the back. You can go ahead.
Back? Oh, okay. My question's mostly for Mark and Shakira. I'm not advocating for cars, but as a transit commuter in Boston, I get to see on an almost daily basis how our alternative mobility options fail people who are frail, who have disabilities, families with young children. So have you seen good examples of cities that are taking multi-generational approaches to their transportation planning?
There's some cities working on this. I mean, again, it's coming from the Netherlands. I think they're more progressive in some of this way. And yes, it is an issue. Not everyone can cycle. I mean, you need to have alternative. I don't think we ever can have completely car-free cities. I mean, or there needs to be some way where you take care of the elderly, the young kids. I mean, that also need to get around that. Thinking about this, I mean, it's not so easy always, but I'm sure, there are lots of improvements that can be made. A lot of people actually, sitting in the car, they don't need to be in the car, and they actually can get out and use other means of transport. I've been talking about cycling, but there's of course public transport as well, and that's extremely important. It's often forgotten. Cities or governments don't want to invest in it. It says it's an awful lot of money, but of course we need more. I mean, at the moment, as individuals, we all together spend so much more on transport than actually we need to. If we put in public transport, it would be all much cheaper for us to get around. Unfortunately, that political will is often not there. I mean, and I think we need that political will. And it's coming back again that we need to have more political will to make changes, and changes for the good.
I'm thinking about multi-generational. I can't say that I have a lot of good examples of how transportations have been adapted to multiple generations. I mean, public transport does a little bit of a better job, mostly thinking of limited, people with limited mobility, but not necessarily with a family in mind.
This is sort of one of the topics that comes up a lot when we talk about the ride-hailing industry, and we talk about the promise, which is very lofty, of autonomous vehicles. But a lot of the folks in the industry that are promoting these kinds of modes as something that can address some of these kind of access issues. Uber has a big promotion now out all about disability access. So far, we haven't really seen like a huge kind of a demonstration of the effectiveness, but the potential is kind of there. So it's something to look at. A lot of southern cities, a lot of places where you're seeing huge kind of, Sunbelt cities with large retirement, not necessarily thought of as great progressive places when it comes to transit policy, but some of those places in Florida and Arizona have pretty robust infrastructure for public transit and disability access.
And if I can add to that, I think the big issue is also that there isn't much sectoral conversations happening. For every huge housing development that goes up, there's no repercussions on what happens to the transport systems. So you have these multi-story high-rises going up, but really no understanding of what kind of pressures it's going to have on transportation. So unless those two sectors start having conversations, then we're also heading for more troubles in that way.
I'm told we're out of time, but we have time for one question, and you are standing. so
Wonderful. I've been
you
holding the
can-
mic. Well, I thought Monica did a nice job of articulating the challenge of sometimes when you bring in these solutions that are healthier, that make places nicer to live in, that results in gentrification, increase in housing costs, and displacement of people. And you mentioned there are some solutions. I'm wondering if any of you know specific examples from cities that have been able to introduce these solutions and not displace people. And also, as you're studying this, how do you know you're not just counting, the health improvements from now there's a healthier population moving in as well?
I certainly think that that is an area where we need to invest more resources to answering those questions, because a lot of times when we're designing studies, we are focused on the health outcomes. But I think understanding from this conversation that the economic revitalization and livability, and then the health and environment of a neighborhood, I don't think those two things have to be mutually exclusive. So there's a lot of opportunity to change the way we ask questions so that our science can actually be more relevant and useful. Policymakers often don't have access to full text articles, and so if we start changing the way we conduct our research and ask questions, I think we can generate data that is more useful to beyond scientific audiences. To my knowledge, I don't know of any ideal examples of cities that have done this really well in terms of preventing gentrification that leads to displacement, and I'm wondering if others have examples that they might share.
There were two things that came to mind. One was there was a recent study in the American Economic Review about a housing project in Chicago that was actually demolished because it was in terrible shape. And this individual tracked the outcomes of people who were displaced from that housing project. And eventually they went to basically better neighborhoods and better housing, and you found that they did better as a result of losing that horrible housing that they had. So there's possibilities of complementarities between creating options for people that can allow them to access opportunities they may not have had before. It's just, I agree, we're not really thinking hard about that, and we should be. From the standpoint of migrants in this kind of research, the graph I showed you about opioids, I think it's really hard to track people from place to place in the way the United States sort of sets up and tracks people over time, right? It's not like Scandinavia where you can follow everybody forever and their children. So it's a huge challenge, and I think that there's kind of some concerning things happening on the horizon about the availability of public use data, and I think this is just something that for all of us who are trying to study these questions and track people over time, because I think it's very material to make sure we can separate composition effects in cities from the effects on the people that lived there at one point. I think we should be very vigilant about the kind of data that is being collected and making a real case for trying to track individuals over time and make that data easier for policymakers and researchers to have.
Our time is up, but thank you so much. Please give it up for our panelists. Thank you.
So right now we have a 15-minute break. The sessions this morning, I think, stimulated a lot of thought. I know I'm bubbling with additional questions. Hopefully we're going to interact with each other during the break as well as later today. And we're going to reconvene in about 3 minutes after 11. Right?